Hello and thanks for watching this video about anxiety disorders. Many different types of anxiety exist. Debilitating to terrifying for the sufferer and their loved ones are just a few of the possible outcomes. Along with emotional and psychological symptoms, it also manifests physically. Let's examine a few anxiety disorders, together with their signs, symptoms, and therapies. A panic disorder is a kind of anxiety characterized by a rapid onset of intense dread even in the absence of a serious threat. Physical symptoms of panic disorder include fast heartbeat, stomach and chest discomfort, trouble breathing, and dizziness. Weakness, vertigo, perspiration, a chill or heat sensation, or tingling or numb hands. Imagine how frightful the symptoms by themselves may be. One person characterized it as having a crippling sense of losing control. It may happen to the patient at any time and without warning. The patient's symptoms are frequently referred to as a panic attack. Women are more likely to have panic disorder, and it usually first manifests in younger adults. Psychotherapy, such as talk therapy, behavior modification, and medications make up the course of treatment. The term SSRIs refers to the class of antidepressants that are the most widely used. Fluoxetine, citalopram, sertraline, paroxetine, and escitalopram are a few SSRIs as examples. An intense, unreasonable fear response to a particular thing, location, or circumstance is known as a specific phobia. This may interfere with normal routines. Animals, germs, heights, thunder, driving, public transit, and other specific phobias are among the most popular targets. Elevators, flying, and dental or medical treatments. Merely if many who have phobias understand that their dread is unfounded, even thinking "Abu." It frequently results in severe anxiety. Childhood, adolescence, or early adulthood are all possible onset years for specific phobia. Social relationships may suffer, and self-esteem may be impacted. Psychotherapy, talk therapy, and carefully monitored exposure therapy are common treatments for certain phobias. Exposure to the dreaded thing or circumstance in an effort to become used to it. In severe situations, antidepressant medicines may be employed. In the United States, there are more than 6 million instances of generalized anxiety disorder each year. GAD is characterized by continuous and uncontrollable anxiety about a range of factors, such as money, health, family, and job, or other difficulties. People with GAD frequently predict calamity, which can make it challenging to get through the day. They frequently try to control things because they lack the knowledge to break the cycle of anxiety. To help them feel less anxious, by having the patient with GAD participate in cognitive behavioral treatment, express their emotions, talk about them, and learn about anxiety and its signs to help prevent the escalation. It pays close attention to the patient's actions and bodily signs of anxiety, because of the concern and the desire to provide them with resources to comprehend their actions and create coping mechanisms for it. Therapies like acceptance and mindfulness focus on habits and coping mechanisms like exercise, yoga, and meditation. Again, SSRIs are helpful in the management of this disease. Because depression frequently coexists with GAD, the patient might profit from several therapy options. Also for depression, when someone is anxious about leaving a loved one, they are said to have separation anxiety disorder. A caretaker or parent. Though it also happens to adults, this is frequently seen in kids. The diagnosis of separation anxiety disorder is made when symptoms are too severe for the developmental stage. Aging in serious distress in day-to-day functioning. Recurrent or excessive anxiety about leaving home or anticipating it are just a few symptoms. Those you love, persistent, overwhelming concern that a parent or other loved one may pass away through an illness or catastrophe, persistent anxiety that something negative would occur that might lead to separation, including becoming lost or abducted, reluctant to leave home out of dread of being separated from parents or other loved ones, not wishing to live alone at home without a parent or other close family member, unwillingness or refusal to have frequent nightmares about being separated, to sleep away from home without a parent or other close family member nearby. While a parent is absent, there are frequent complaints of headaches, stomach aches, or other ailments, or another close relative is expected. Anxiety disorders such as separation anxiety disorder and panic attacks may be connected. Repeatedly occurring bursts of severe panic, horror, and anxiety that climax in a few minutes. Stress has been identified as a component, and genetics and the family environment may also be involved. As separation anxiety can occasionally result in other conditions, treatment options might range from psychotherapy to medicine. Despair and anxiety issues. The inability of the youngster to talk or engage is caused by the rare and complicated childhood anxiety illness known as selective mutism. In social contexts, such as school, but is able to interact in circumstances where they feel comfortable. This transcends mere shyness. The youngster is unable to talk because of the anxiousness, not out of choice. The symptoms must persist for more than a month in order to be correctly identified. A therapist will rule out any physical factors, including hearing loss, speech and language disorders, and work with the youngster to model behaviors. They can show footage of them conversing with others to the youngster or gradually introduce to the circumstances resulting in the mutism. Intense worry or fear is the distinguishing trait of social anxiety disorder, often known as social phobia. Of facing judgment, a poor assessment, or rejection in a social or performance setting. These people have physical symptoms including a quick heartbeat, dizziness, and headaches when they think about being in a social environment. Avoidance will be used as a coping method along with fast breathing and perspiration. It is the second most prevalent anxiety illness to be diagnosed, affecting 15 million Americans. The severe symptoms of social anxiety disorder can seriously interfere with daily tasks due to the possibility that they won't attend the essential occupations, institutions of higher learning, or social gatherings. Although there are therapies available, only approximately 5% of those with the disease immediately seek them out, whereas the majority of patients wait years before seeking help. Treatments including cognitive behavioral therapy, talk therapy, and, if required, antidepressant drugs assist patients in managing this disease. Similar to the prior social anxiety disorder, agoraphobia is a dread of social settings. Aside from agoraphobia, which is characterized by panic attacks that eventually cause a person to wish to stay inside their house, for fear that if they do, they may experience a panic attack. Fears of crowds, standing in line, enclosed areas, and leaving your house alone are among the typical agoraphobia symptoms. Open areas, such parking lots, bridges, or shopping centers, enclosed places, like theaters, elevators, or little businesses. And using a bus, aircraft, or other kind of public transit. The following symptoms are part of an agoraphobic panic attack: fast heartbeat, chest pressure or discomfort, difficulty breathing, faintness, or a sense of suffocation, trembling, numbness, or tingling, excessive perspiration, abrupt flushes or chills, diarrhea or upset stomach, losing control and having a dread of passing away before the age of 35. Agoraphobia typically begins in the late adolescent or early adult years and is more prevalent among females. Other anxiety disorders, depression, and drug or alcohol addiction are risk factors. Antidepressants and psychotherapy are the therapies for this disease. In conclusion, anxiety disorders may be debilitating in range and severity. From mild to severe can have an impact on the person's everyday activities. Fortunately, there are several therapies available, including counseling and drugs, that are advantageous for those with anxiety issues. Happy studying and thanks for watching.